Hey guys, welcome to Back to Leagues. Today we're gonna have we have a very special guest, Maria Santos from the University of Michigan. She's one of our M4 senior medical students. She was born in Bogota, Colombia, and grew up in Atlanta, Georgia. And she graduated with a bachelor's in biochemistry with a religion and philosophy minor from Berry College. During medical school, Maria has worked extensively with the Latino Medical Student Association in the Midwest as a Midwest fundraising chair, Midwest policy chair. Most recently, she took over the position as national vice president and chair of policy. She's currently also serving in the leadership team for Voter, which is a nonpartisan, nonprofit organization seeking to bridge the gap between sorry, I forgot this, between healthcare and civic duty. Other projects have included the Michigan Migrant Clinic, the National Medical Spanish Task Force, and the community-based research of Latinx mental health in Southeast Michigan. She is going to be applying to family medicine this season. So if you're looking for an awesome family medicine intern coming 2021, she's out there looking for a job. Today, Maria is going to walk us through trainee level advocacy and policymaking for medical students. Maria, thank you so much for joining us.
Thank you, everyone, and thank you to everybody here and all the future people that will hopefully be watching this. Yeah, just thank you for inviting me. I'll go ahead and get started. Let me share my screen. And the way I have sort of set this up, let me just make sure you can see everything. Okay. Does that look okay on your end? Okay, great.
That looks good.
Okay, sweet. So yeah, like Val said, I'm basically just gonna walk you guys through what it means to be involved in advocacy and policy as a medical student, ways to be involved. I'll tell you a little bit about my own story, and then hopefully I'll have enough time at the end for questions, and then we can just have a discussion about things to keep in mind as we go through this as well. So full disclosures, Val mentioned it. So I am the LMSA VP and Chair of Policy, which basically just means that that's one of the lenses that I'm bringing into this talk. And I will throw in some like biased advertisements and plugs for LMSA related events, as well as other things that we do through our organization. And then the second disclosure is I am on the leadership team for Vote ER, which I'll talk about during my presentation a little bit more. But again, just throwing in that lens as well. So just an overview of my talk for today. First, I will discuss the terms. I think sometimes people use them interchangeably, but I think it's important to talk about the distinction between a lot of the things involved in health policy and healthcare policy and things like that. I'll then walk you guys through just some basic steps into journey of advocacy. Then I'll go over my story as an example, walking through these same steps. And then we'll just talk about ways to be involved as you go through medical school. And so first, just what is policy? So policy is basically just a principle that allows a government or an organization to operate. And it has to be usually like voted on. Some examples can be, immigration policy, an attendance policy for school, insurance policy, dress code, really anything can be a policy. But again, it's just, it sort of sets up the restrictions for how you operate within a system. Big distinction here. This is different than politics. So the activities basically in terms of like politics, it has to do with like how we operate within a government. And so these are ideals that can be debated among individuals and eventually like whoever comes into power. Next, let's just go back a little bit and talk about health policy specifically. So when we talk about like health policy, of course, like we know, we talk about insurance policies, we talk about maybe like what what policy a health system is operating under. But I think really like the best way to think about it is, and I highlighted some of this here, it really defines a vision for the future. And it also allows us to define like priorities and the expected roles of individuals within a health system. Some examples, like just for instance, like Michigan outlawing e-cigs, right? We see the tie-in of like a specific law or policy into how we operate and how we want our society to intersect with health. And so, as we know, healthcare policy is not the only kind of policy that will affect people's health directly. So when we talk about education, we talk about finance, housing, transportation, community, all these things that, of course, like governmental policy effects will by like virtue just end up affecting healthcare policy as well. And I know like, I'm coming at it from a lens of course, like primary care, because that's what I love. But throughout this whole talk, I want you guys to really think about, as future surgeons, like, how does this relate to me? And of course, like whoever I'm operating on, that person's like pre-op and post-op outcomes are going to be determined by this right here. In addition to, of course, like all the suturing you guys do. So I want to next just take a step back again and talk a little bit about advocacy versus lobbying. And again, like right now, we're just going over the terms before we really delve into them and specific things you can do. So on the left here, I put the definition of advocacy. So this is basically just any kind of activity that will bring attention to a cause or promote some sort of like movement. So I put a picture of just like an advocacy event we had, I believe now it was 2 years ago, maybe it was a year ago. Honestly, I've lost track of it by this point, but we had an event where we were trying to bring about attention to all the like Cajun stuff that was going on in the border. And so we had this White Coats for Human Rights rally where we had medical students across the country take pictures like the one I have here, and just bring attention to this. So that's advocacy. That's more of like a social conversation. On the right hand side here on my slides, I put in like what lobbying is. So these are specific activities with the end goal of changing legislation that already exists within a government. So this can be contacting your elected member. You can oppose, support, or even make like changes or suggestions to a current legislation or an upcoming legislation. And then again, within the window of even lobbying, there's two different types that I want to talk about. So first is direct lobbying, and this is when you actually talk to like an employee that is working, say, within like a congressperson's office or an elected official, like you're talking to them directly. The other kind that I think is like what I've spent the majority of my time doing is grassroots lobbying, which is essentially influencing legislation, so policy changes through opinion of the general public. So again, this grassroots lobbying and advocacy are very like intertwined and very easy to combine together. And so just like, like a lot of policy related activities don't necessarily count as lobbying unless you're specifically targeting like an elected member or a decision maker in terms of a vote. But like I wrote here, education, like educating the public about issues or having meetings with people about issues, or even just like showcasing or bringing attention to an issue is not considered lobbying. And so this is important to us because when we think about healthcare, I think we want to have the mentality that we treat all. So we don't want to alienate anybody that doesn't think like us, but we can present sort of an objective way of looking at policy. And that is also how like the general public can look at us and how we can frame a lot of where policy can go. So why this matters to us, like this is no secret. The issues with racial and ethnic inequities in this country really affect the kind of like healthcare people get. I just put these like studies that I found today in terms of, you know, surgical outcomes and why that matters to know about that. And just the other day, I was talking to Jessica and Kelly actually about the need for surgeons and people not in primary care to really start looking and researching these things because they really do affect the surgical outcomes that they have. And then of course, the second study here is COVID has really, I think, shed a light on the need for changing the way healthcare operates in this country and moving towards a more equitable society. So I would encourage you guys, especially as you're now like starting your career, like to keep in mind the trajectory of what you want your career to look like and what change you want to bring about to medicine, because we truly are like the future of medicine, and we can dictate where we move if we stay the same or if we change. I had to put this quote up here. John Lewis, of course, he said, "Sometimes you have to do something out of the ordinary. Sometimes you have to make a way out of no way. We've been quiet for too long. Now is the time to get in the way. We will be silent no more. The time for silence is over." Of course, I'm a huge fan of John Lewis, but I think more so than that, it's important to remember that when he started his career, it was a time when there was no like, you know, already made path for advocacy and for change, and he created that path. And as we think about us, you know, as minority individuals in medicine, we have to make our own path. We have to make the changes that we want to see, because nobody else is really going to do that unless we commit to doing that. So this brings us to my step-by-step guide to advocacy. And this is, of course, not the only way to go about doing things. This is just, I think, what my journey has been and how I've sort of had a chance to reflect on and want to share with you guys today. So I think the first step is sort of taking a look at your life and dividing it into like internal and external motivations for action. So the first component is the internal motivation. So that's when you look internally at your own morals and values and the things that you care about. And this, the way you like build on that is through, you know, talking to people, to listening to them, getting both views or multiple views of like an issue, getting different perspectives, and then researching, doing your own research. And this is like this is a daily thing. Like, for instance, like I start my day every day just reading the news from like multiple news outlets, and then learning like one thing about health policy. And I'll share some resources for you guys at the end that just allow you to like carve that time out into your day, so you really build on yourself and the sort of presence that you want to have. So that's one component. The other component is more of the external factors. So how you interact with others, how you may influence others, and how you essentially put an action behind your internal motivation. So I'm going to use my own story as an example of how I've tailored my the things I care about in my own journey. And then we'll like go through this, but again, this is not like just one way of doing things. This is just like how I've done it. So as Valeria said at the beginning, I'm from Bogota, Colombia. I moved here when I was about 8 to Atlanta, Georgia, and I included a picture there on the right. I don't know if you guys remember a bank that I don't know if it exists anymore. It's called Washington Mutual. But this picture we took, like, I think it was like this must have been the day after we moved to Atlanta, and we opened up like a bank account. And I just love this picture because you know, I think what centers me is the fact that I'm an immigrant first, and everything that I care about and everything I have lived through has been because of this like first initial experience. So as you guys are thinking about your own story, there's times in your life, particularly in childhood, where you really frame the kind of person you are. And if you take the time to reflect on these moments, I think it really sets you up for defining where you can go after. So of course, like I was an immigrant, and also I will just say, because I'm just like so proud of them, this is my dad, my mom, my grandma, and my brother. Yeah, and I love them. But anyway, so why I went into medicine, I think ultimately it was, you know, as an immigrant, I was like, I'm gonna try to be that model minority, right? I'm gonna try to excel. I'm gonna try to like be a doctor. Like, I think at one point was like, I want to be a neurosurgeon, like just like super, quote unquote, like prestige. And I will be honest with you, I didn't really think about it in terms of like, oh, I'm gonna change society. I'm gonna help people. Like, that was like not really my motivation. It was very much, I think, a motivation that a lot of immigrants share, in that we just want to make our parents proud. And that was at the center of everything I did. At the same time, while I was having these thoughts, I was still, you know, like an immigrant in the deep South, and saw a lot of disparities happening within my own family, and my like Latino community. So for instance, like when we first moved here, so my grandma like had diabetes, and she had like a really tough time finding healthcare. And I remember we used to have to drive like 2 hours away, to find like a free clinic that she could get her healthcare at. And these are things that I didn't realize, of course, at the time, but only like recently reflected on, that have really shaped what I care about. And so really what changed for me was when I came to medical school, and I like very, very quickly learned that there were so many other things beyond, you know, the biochemistry we were learning in class, and the, you know, different pathologies of things that affected healthcare and that affected people, and ultimately the kind of life that they had a chance to live. And that moment really happened for me at the first LMSA conference I went to, and which was in Chicago and Loyola. And it was the first time that I was like, oh my gosh, there's like other people that speak Spanish, Spanglish, like get it. Like you immediately just like when you go to an LMSA event, you just get each other. And I really saw the power of community, and immediately realized that I wanted to invest in my community and invest in giving back to the community that like brought me here, essentially. And so, like I mentioned earlier, like I became the fundraising chair, but then I quickly realized that like policy was where my heart was at. And so I was elected the Midwest policy chair, and started getting involved in like writing statements, writing op-eds. And then one thing led to another. And then I became the national VP of policy. But again, it was like a very like stepwise approach. And it was an approach that was based on the things that motivated me and the things that didn't feel like work to me. After this, I was recruited to be on the VOTR team. And then I've really just like firsthand seen the power of policy. So one example is we recently wrote a statement sort of denouncing the ICE's policy to basically deport all of the international students that were here because of like online classes. And that's a terrible summary, but that's what was happening. And so we wrote a statement through LMSA that got like over, I believe it was like 10,000 signatures last time I checked. And then the AMA wrote a statement. And then, you know, like we really saw the power of our voice like carry out through that. And then with VOTR, which I'll tell you about a little bit, like we're seeing the culture of medicine change, and we're seeing civic engagement change, really. Okay, so going back to the stepwise approach, so importance of story of self. So this takes time to develop, but it's a lot of reflection. It's a lot of exploring different ways of looking at the same thing. I, of course, come from a liberal arts education, so this was like ingrained in me very early on. But once you have that story, you can really like find like 2 or 3 things that you really, really care about and can hone in on those, because you can't really make an impact or change things if you're just like surface level, like trying to change a million things at once. Um, so really honing in on what you care about, what your values are, and going beyond just like the surface level action and intervention. Next step is finding your people. For me, of course, I mentioned it was LMSA that changed me, because I really realized the power of many versus just one person. It also helps you when you meet people that care about the same things you care about. It helps you keep your values at the center of your work, not only together, but beyond. Um, it also, of course, allows like a team-based approach to advocacy, and that I think is a reflection of like a team-based approach to medicine as well. I think when you get different perspectives, people from different backgrounds, say like a primary care doctor and a surgeon and a dermatologist, like working on one problem, you can tackle it, I think, from a lot of different ways and ultimately find a solution. um Next step is like messaging. How you share your message, how you share your values is super important. I think it's very, very important for not only like minority students, but anybody really, to publish. You have to, if you want to change the direction and the culture of medicine, you have to share your thoughts, and really remember that some of these thoughts are new to a lot of people that have traditionally been in medicine. Um, so it's really up to us to almost like guide the conversation and guide the direction that the change is going to take. You can do this through op-eds, writing statements through an organization. And when I say organization, I mean an organized medicine group. It can be SNMA, it can be LMSA, really any group. And then, of course, now we know social media has become a key way to connect and build your own advocacy portfolio. And so being really intentional about the things you care about and what you post, not just being by virtue of like what's trending, but really like what you care about. Like if somebody 10 years from now goes back on Twitter and sees that you have been working towards these things, I think that says a lot about who you are. And so keeping that in mind as you like use social media is really important. Here, I just posted 3 different options for submitting op-eds and writing. It's easier than I think a lot of people think. So for instance, like JAMA has a viewpoint that it's sort of like an op-ed. And that one is probably like the hardest one to get into. But I think like with the right message and, you know, the right amount of research and commitment, you're going to be able to showcase messages on there. Kevin MD is the most accessible out of all of them in terms of writing an op-ed. He also recently started podcasts. So I think like that's another, usually when you submit an op-ed to Kevin MD, he often asks you if you want to be interested, if you would be interested in doing a podcast episode with him. And I think that's another great way. He has like a very large following, so another good way of doing it. And then Academic Medicine recently released a letter to the editor section. Same thing, it's an op-ed. The only thing about that is it takes like 2 or 3 months in terms of getting it published once it's accepted. So just keeping that in mind if you're trying to like publish something sooner than that. I'll take a moment now to just talk about the importance of being nonpartisan when you're talking about these issues. So we can't get anything done if you are. Obviously, I think that's a reflection of like, well, how the government is operating. I think I'm just going to list some examples here. So for instance, with gun violence, framing it as gun safety. abuse at the border, humanitarian crisis, abortions, reproductive health, and reproductive justice. So being smart about your messaging will ultimately help you influence not only the public, but like legislators and things like that. And it also allows you to remain a quote unquote objective source of information for people. And so we've seen it with COVID, we've seen it with racism. The moment you like politicize issues, the moment I think that just like change gets really truncated. So I just encourage you to like, of course, like we're in very murky waters right now in terms of like who we are as a society, but I think it's important to know what's objectively right and wrong, and almost like distancing it from any political party. So I'll give you guys an example of this, and hopefully this will work. This is our Vote ER video. I'm gonna try to play this, and then if it doesn't work, I'm just gonna see. Can you guys hear it?
We can hear it.
Yeah, I wish I could tell you that was one story about that one time I saw a child mutilated by bullets. Or that time I cared for a family so hungry they came to the emergency department to send me food. Or that one time where I couldn't discharge a child home simply because there was no home for them to go to. See, it's not just one story. It's just one time. It's just far too many to count.
COVID-19 is just exposing how broken our healthcare system is. I remember at the beginning of the pandemic, we had patients desperately asking to be tested. My response, I just didn't have any tests to send. I remember one patient asked me, well, doctor, how is that fair? I just saw the entire Brooklyn Nets got tested 2 days ago. I didn't know what to say.
This spring, as the coronavirus pandemic heated up, I began to wonder what would happen with Wisconsin's spring primary. It never occurred to me that our state would actually risk people's health by holding an in-person election during a pandemic, particularly when safer alternatives were available.
COVID-19 has made it harder to vote in safe and healthy ways, particularly in communities of color, where we see those most impacted by failed healthcare policy.
And that's not why I went into medicine. That's not why I became a pediatrician. I didn't do this to experience countless stories on how policy continues to fail children, particularly children of color.
But providers like me, we can do something small but powerful, to ensure that our colleagues and our patients have a seat at the table.
We've created the Healthy Democracy Kit to help you do exactly that. The Healthy Democracy Kit consists of a Vote ER lanyard and badge backer that you can make a part of your regular ID cards. The badge backer that you will receive displays a QR code along with a text code that will direct patients to a nonpartisan online voter registration portal that's specific to their state of residence.
In our Vote ER Healthy Democracy work, we have a few core beliefs. We believe that empowered voices in communities lead to positive health outcomes. We believe that by voting for our health, we can preserve what works or demand change for the things that don't. We believe that our healthcare system is stronger when we, as providers and as patients, all show up.
Doctor, what's that badge? This badge allows you to register to vote on your own phone. All you have to do is shoot your phone at this QR code or send this text message to this number, and the platform walks you through all the steps to get registered to vote or request your mail-in ballot in 90 seconds. I gotta go see another patient, but the platform will walk you through the rest.
Of course I'll register to vote, but who are you voting for?
I'm voting for you and your health.
With all that's going on with COVID, I really want to make sure that you can vote in the safest and healthiest way possible. And the best way to do that would be to vote from home. I can help get your vote from home ballot while you're here in my office today. Every time I feel like it's Groundhog Day, from now on, I'll ask my next patient, are you ready to vote?
As healthcare providers, we cannot tear down these barriers to equity by any one prescription or procedure. We know the limits of our reach. We also know the power of a vote.
Watching all of the drama surrounding this election unfold made clear that we must begin preparing for the November election now.
So vote.
Vote like our health depends on it.
Vote like our health depends on it.
Okay, so I think basically shameless plug for it, but also the importance of, if you guys could see, like, not necessarily saying like vote for a certain party, vote for whatever, but how can we talk about these things with patients? How can we say like, this isn't working? And like and while like, you know, voting's not going to fix everything, I think it's certainly like a step in the right direction. And again, like in the video, when they talk about, when they do the example of like, if a patient asks you like, who are you voting for? Like saying like, I'm voting for you and your health. Like that is what I care about, is your health. I think that's really important as we do this work. Okay, so now I just want to give 2 examples of like just very quick things that you can do. So 2 of my policy chairs I've recently helped write an op-ed, and really like they have had so much like success in sharing this piece, this top one right here. And I think and these are 2, I think, yeah, they're first year students. They might be second years now, but point being, like, they're young in their career. They like came to me with no plan of writing an op-ed, and I was like, write this, like write the things you care about. You have such a unique perspective. And so again, just emphasizing like your voice really matters. The second one is one that I wrote with a friend, my friend Karina, a year and a half ago, maybe 2 years ago. But it was basically just how we organized our virtual like rally event. And so this is essentially what we did. We had people around the country hold up signs, bring in like cages, which I don't know where they got them, but they got them, and take pictures and really share this message out there, and call like legislators out and really push for change. So how can you be involved as a medical student? I think you can certainly organize your own event whenever you want. You can, of course, call your representatives. You can join the AMA, you can join LMSA, any of the other organizations I've talked about. And then I will, again, shamelessly put in a plug-in for the Policy Summit that's going to be virtual this year through LMSA. Those are the dates that we have listed here, October 2nd to the 4th. We have a really, really special event planned for this year. A lot of big names in terms of physician advocates and policymakers will be joining us. This is the official poster. And then registration is up now, so you can find that on our website. And yeah, some things that we'll cover at the summit, just so you know, a lot of the things we've been talking about, I think we're doing a mix of both like internal advocacy and external. Internally, you're going to learn a lot of different things through our workshops or different tracks, but externally, we're also doing legislative visits virtually with elected members of Congress. So typically this event is in DC and we get to actually go to Capitol Hill, but this year, since it's virtual, we're still going to have very similar experiences available to the people that attend. Of course, we have resolution writing, which is basically something we do through our organization to dictate what issues our organization wants to advocate for, wants to care about, and make change happen. And then, of course, like we'll have a panel of experts. It's just a really great event. And yeah, I really hope that you 3 will go. And anybody else watching this, I think it'll really set you up to picture yourself as a future physician advocate and potentially policymaker. So I'm nearing the end here, and these are just like the big takeaways that I wanted you guys to get from the talk. So first is you got to know yourself, you got to know your values, got to know what you care about. I think medicine, well, by virtue of just how long the training is, it makes you feel like you're being pulled in a lot of different directions. But really staying true to what you care about will make you, I think, different than just from like a good physician to a great physician. I think it's important to know that your voice matters and it can lead to change. I've seen this time and time again. I used to be like super nervous to talk to elected officials. I thought they like knew so much. They don't. You know a lot more now. And so just know like you are the experts of your own experience, of your own stories. But don't let it go to waste, you know, share those stories. Surround yourself with people that want change and will push you towards change and will push you to be better. I think that's key. And also like push you to dream bigger, to aim for bigger things. And then lastly, I hope you guys are hopeful for the future, hopeful for change. I think it's really easy to get caught up in all the noise. But I feel so fired up right now and hopeful that not only medicine, but society is moving in a good direction. And I really feel like I'm part of that. And I want to like ask you guys to join me in that, ask anybody to join me in that. And yeah, this is my, I guess, shameless plug for Michigan Medicine. If you guys have any questions, we can do that now. And then you can reach out to me here. And of course, go blue. Here are my references. And that is all I have for you guys. I can hear the roaring applause.
That was awesome.
Well, we all unmute ourselves. Let's see. Oh no, it's gonna share my screen. Maria, that was awesome. Thank you so much. I'm gonna stop sharing my screen right now so we can all see each other. Awesome. Any questions, guys?
I have a question. I think a lot of people I've heard are like intimidated by getting involved in policy. Just, you know, it seems like so inaccessible, or talking to legislators can be like scary and intimidating. And I guess like, how do you get people to overcome that like first hurdle if they have never engaged in any sort of policy before? And then my other question for you is, how do you keep the momentum going from like when you're in medical school to then residency, when you're strapped for a lot of time? And I feel like a lot of maybe residency programs are like, oh wow, like you did so many cool things in policy, like that's so great, like welcome, open the doors for you. And then you get there and then they're like, oh well, we can't support you going anywhere, like you don't have the time to go to any more conferences. So I guess like, what can you do? And I don't know if you like necessarily have the answer for this, but for people who are passionate about policy, how do you make that a part of, you know, like your career after medical school as well?
Yeah, those are great questions. So first question I'll answer about how daunting like the process seems. I think so the first time I was exposed to it, I remember was at the first like policy summit I went to. It was like kind of like I just like went into it, and I immediately, like the second that I talked to a legislator, I realized that they have no idea. They just have no idea about the things that we find like second nature. Like what we see with patients, the struggles that we see in patients, they just are so disconnected from that world. And so in the same way that we view them as policy experts, we are health experts. Like we have been health experts the moment that we stepped into medical school. And so I think like what I do is really just tell people that in the same way that you find these people so great and whatever, like you're great. And that's how they view you, you know, like the second you walk into Capitol Hill wearing a white coat, everybody's listening to you. Everybody wants to hear your perspective. And like, just like to share some stories, like I have a lot of like DACA friends who have had their stories shared on the floor, and those were from our visits. You know, those stories came from those visits. So I don't know, I think like that's why it's so important to share like your own journey, I think, because then you show people that, hey, like somebody I know is doing this work, and somebody I know is really like making change happen. I will also say like it's a lot of like medicine, like you just like go for it, learn, and then you learn a lesson that maybe like you could have done it better, and then you go forward and do it better the next time. Every time I talk to a legislator, like I learn something new. I learn how to say things better. I learn how to communicate better. And of course, like, and I'm like rambling, but I think mentorship is so important. That's why I like make myself accessible to people. And as you go through medical school, like do the same. I always share my phone number. I'm like, call me, text me if you want to talk about like what you want your career to look like, if you need a vent. Mentorship is like key, and seeking, not only like seeking them out, but like seeking out mentees. Like it shouldn't just be on mentees to like find you. So yeah. And then the second point, this is like so funny. I was talking to some friends about this recently, because I don't know really what residency is going to be like. But I think the issue that I'm sort of gathering from hearing people share their stories is that medicine doesn't prioritize like health disparity work and policy work, and it's almost like a hobby, and it's almost like, especially I would add in surgery, or like subspecialties, it's almost like not as like flashy. We don't give as much money into it, but if we want to find a protein, like sure, let's pour like millions of dollars into it. But I guarantee, like, if we start looking into and researching health disparities, health outcomes based on like, housing inequalities and things like that is when we actually will be able to find like a solution to so many of the disparities we see. So I don't really have a good answer beyond just like, you need to be, again, like, know yourself, know your values, be stern about what you care about. And it's kind of like because there's not too many people, I think, that have done this work in medicine, just because they've had to fight like a culture. I think taking advantage of the movement right now, people are saying they care about this stuff. Okay, so put your money where your mouth is, right? Like, you care about racial disparities, give me money for this research, like, and that is a conversation that I think is important to have, not only in medical school, but once you go to residency, like saying that, like, I care about these things. Like, for instance, like Val, right? Like, she cares about training the next generation of like minority physicians. And she said that to the program here, right? And they are showing like, okay, this is how we're going to support you. I don't know beyond like what I can hope that I will do and continue prioritizing, but like once I get into residency, but I think this is just like who I am. Like, I can't practice medicine without this component of it. And I can't, and I will say that to like residency directors and be like, it's just, you can't have just one and not the other. And knowing that part about yourself, I think, is really important.
I can take the second half of the question just to elaborate. When you ask, I was like, I'm the only resident here. So the short answer is that it is hard. And I definitely did experience when I started residency, like as an M4, like I was like the head of Midwest, like, like the last 3 months of like M4 year, but after like matching and everything, we're like a whirlwind. Like, we had like, I mean, the span of 6 months, like I had to like interview for residency, we through the policy summit, we had like LMSA Midwest, like you just have so many, like you're able, I think, in medical school, and this is why I think is so important. The reason why I wanted Maria to share her experience with you is because, and I think that you guys have heard me said this before, like you will never have more time as you do now, not only to like start engaging in some, like the initial work of like, finding yourself and deciding what matters to you and how you're going to be active and how are you going to do things. The work that you're doing right now, like both in medical school and then in the wards, like getting organized, and like all of this work is like going to translate into something when you become residents, and it won't be 100% what you thought it was going to be. Like, you're pretty good at tying knots right now. I'm like, just wait until someone is watching you on like an actual body and you're like, man, all of those knots on my couch are not working. But in the same way, like the habits of civic engagement as a medical student, like you can just get lost in the water hose. Like you can like, if you, I remember thinking like on Sundays when we were like, we put this health fair together every, like the first Sunday of every month at UIC in Chicago, and we'll go to one of the big churches in Pilsen, and we'll like be in their basement and like hold this health fair for the Latino community. And it always happened like the Sunday before like we had exams, and I always remember I was just like, man, I'm here, and like this is what I need to do, but like I also could be home studying and thinking about like so many people that were just like home studying. However, like realizing that that was a priority and something that I, just like Maria said, like I can't just be a doctor. Like I have to be able to do this, because if not, then I don't know, like this is what my purpose is. And if you want to include, and everybody should have it, to be honest, if we were going to get really radical, not radical at all, like if you're a physician, you're an advocate, and like the main way how you can advocate is by like fulfilling your civic duties. It's like the least that you can do. And so I think it is hard at the beginning when you are like drinking from a second, even larger water hose as a surgical intern, and you end up cutting down. And I definitely did cut down a lot of my involvement just so I could keep my head afloat. But slowly, with the adequate support, because you can also spend 5 years or 7 years in a program that doesn't see value in this, not even just in surgery, on anything, not even just in training. You could go and take a job in a place that doesn't value this, and all the things that they want you to do is operate and make reviews for the hospital. And so like no protected time to do anything. If they don't see your like community engagement as a worthy thing to protect your time, there only exists two currencies in academic surgery. I'm like, are you doing research or are you making money for the hospital? And a lot of the issues that I see with the lack of engagement, or like the varied engagement of surgeons in community activism, at least, which is kind of like my flavor of activism, is the fact that like this is not like routinely viewed as having solid value. Like yeah, if I tell you, oh, I'm gonna go work in a migraine clinic this weekend, or I'm gonna go to a rally, or I organized an event, that doesn't have the same value as me telling someone, oh, I'm gonna go to a lab. And that is a problem, and that has to change, because if that doesn't change, then there will never be a space in which it's like is seen as you doing your job for you to be able to engage civically. Going to a place for residency that is supported is key, not only on the like support of like making things like leaks happen, but in the support of them seeing like and valuing that. Like I haven't written a paper in like at least 2 years. However, I have kind of this, and like this is what I see as valuable, and this is what I feel like spending my time on. And if no one sees value on it, even at especially at the level of trainee, but particularly as a faculty, like you can get very easily rolled into this circle of not being able to engage. And if you decide really early on, like Maria is doing, to bring that to put that foot in front of you when you're coming in and asking for like residency positions and things like that, I think that is meaningful. And then feeling a place when you're not only going to be interviewing one day, I mean, these guys are going to be interviewing really soon, but like you're also interviewing the programs that you're going to, the places that you will become faculty on. I mean, like you guys will be like to be honest, Maria, you're going to be done before I'm done. So like you're going to be attending before I'm attending, unless you do fellowship, which is like the story of the academic surgery resident. And so you will be taking a job, and if that job doesn't value what you value, it can be very challenging, and it might, be all the other things and have the money and like the location, but if it's not serving your social purpose, it will be difficult for you to feel like you are that you're making strides in your job. So it's hard, but it is doable, and if you decide to do it, it is possible to do, and it should. Off my soapbox. Any other questions?
I will just add real quick. I know I've said this a lot, but like we have to like be so cognizant that none of this is going to change if we don't change it. Like it sucks that it's on us, and it sucks that we have to carry the burden of it. I get it, like it's exhausting, but we have to because this, like, to give you like some historical context, like in the last, what year is this? In the last 40 years, the rates of Black and brown physicians have gone up by like maybe 1%. And so whatever we've been doing is not working. And so I really encourage you guys to like be aware of that, like that we're in the midst of change right now. We are in it and we are controlling it. And so I find that to be a very empowering feeling and beginning to our careers. But really, like, take a hold of that and know that you're going to change it. Like, you right now can change it.